You have so many different options. Like the medical field, people don't know, is so vast. So choosing a specialty is very difficult.
My answer today is probably different than what I would have given you as a med student or,
really?
Even an early resident. And but now I can tell you as a fifth-year resident.
That is amazing advice, man. I think that compensation would increase the amount of students going into that field.
Okay, so first of all, I'll dispel some rumors here. There are internal med docs making $500,000.
There's no way. Yo, my name is Yusuf Mahmoud. I'm a third-year medical student. Welcome to my channel. I'm here trying to figure out what kind of specialty I'm gonna do. But first, I gotta think about it the right way. Today, I'm going to talk with Dr. Jeremy Goodman. He's a fifth-year urology resident. I'm very thankful that I was able to have the opportunity to really have this conversation publicly in front of you guys. He is hands down one of the most interesting dudes out there in the hospital. He speaks another language. He is a junior Olympian ping pong player, and the guy even had a stint with the 49ers. Since the moment I've met him, he's always been someone full of wisdom and guidance, giving it to me and all of his peers, so I really hope that you guys get to benefit from that too. If you really enjoy this episode, make sure to like and subscribe. We need to get that 1,000 ASAP. Let's go! So, Dr. Jeremy Goodman, it's really good seeing you here. I'm so glad that you're able to join me in this first ever podcast.
Yeah, happy to be here.
All right. Tell me, what would you say is the most interesting thing about you?
Interesting thing about me?
Yeah.
Well, probably people know me as a physician finishing residency now in urology, but I compete in bodybuilding, and that's kind of been a side hobby of mine that I've taken seriously and have done kind of over the last 15 years. So. With my last competition being at the end of 2021 here in Wisconsin.
Really?
Yeah.
Wait, so while you were in residency, you're still competing?
First time I competed was 2017 when I was a medical student. That was in a men's physique show, and then I transitioned over to classic physique, and that was in 2021 where I competed, so most people don't know that. Well, I guess if they know me, they know that.
Right.
Paper, yeah.
Oh my God, dude, that's not. I was gonna say the fact that you were a junior Olympian ping pong player. I thought that was the most random thing. Like when I saw you, I was like, he's probably gonna tell me like he played some professional sport or something.
Yeah, that was a long time ago where I played ping pong competitively. Growing up, my dad played ping pong when he was a kid. He was competitive, and I picked it up around probably 10, 11 years old, and played it for a good 8 years. When I came back to the States, I kind of transitioned to other things. I got into running, and bodybuilding, or weightlifting, I should say, started at 17 when I got to college.
I think that's pretty cool. I think, are you the only one in your family that did bodybuilding, or what got you into that field?
Yes. Nobody in my family. I've got one brother and 4 sisters. It didn't start off as bodybuilding per se. I just went to the gym like most college guys, you know, did all the standard bro things. I had done running in high school. I was overweight as a kid, lost some weight kind of as I became a teenager, got into running, and one day I just stumbled upon the gym, like the college gym.
Yeah.
There were 2 gyms at Stanford at the time. Now they've got a whole bunch, but it was like there were 3 gyms actually. There's like the gym for athletes.
Yeah.
I was not an athlete per se. There's no ping pong there. And then there was the college gym where it was more serious, bigger. And then they had this small gym called Treseder Gym, and it was like tucked away in this crevice corner. I was really self-conscious. So I went there, and I no idea what the hell I was doing, but I recognized a lat pull down and a leg extension machine, and I just got on there, and I was looked at the instructions, and that's how it started.
Dude, that all makes sense now. That's why your lats are the biggest part of you, man.
They're the first muscles I trained.
Yeah, that's awesome.
Yeah, that's how it started.
As you know, all the medical students, they come in and they're teaching you everything in medical school. So you have so many different options. The medical field, people don't know, is so vast. You can do so many different things. You can have a 9-to-5, or you can work like hell. And there's so many different characteristics to every field that's a little bit different too. Like you can be a surgeon, you can be someone who's mostly in the office. So choosing a specialty is very difficult. So I have this roadmap to choosing a medical specialty that was built, that's actually on Stanford's website.
Okay.
Coincidentally. And they had created and adapted it from this book called The Ultimate Guide to Choosing a Medical Specialty by Dr. Brian Freeman. And so there's like 6 or so different things that you should consider when choosing a specialty. And I want you to rank them from top to bottom.
All right.
So here, I'll put it in front of you here. So number 1 is the area of scientific clinical interest. So in other words, like we're talking about the specialty, like are you super interested in pharmacology / physiology, then you probably lean towards anesthesia. Mm-hmm. If you find the heart super fascinating, you're going to lean towards, cardiology or things like that. So the area of specialty or clinical interest is one of the categories. Number 2 is preference on whether or not it's surgical, medical, or a mixed specialty. Everybody always that's actually typically like the first question all the doctors like trying to tell me, like, hey, first thing you got to think of, surgery or not surgery, right? Like, I guess that's typically what people say, how you make your decision or how you start it off. Number 3 is interesting too, types of non-medical activities you want to engage in. So let's say like you are super interested in research. Mm-hmm. There's fields that are more for you than not when it comes to like research. There's a lot of research in urology. There's a lot of research in oncology. There's not, relative to family medicine, there's not that much research compared to. Number 4 is amount of patient content and continuity. Do you want long-term patients? Do you want to talk to them just a little bit, or do you want to talk to nobody? And then patient population, that makes sense. You want to deal with kids or older people, work-life balance, and then earning potential. So tell me, from 1 to 7, how would you rank these?
Sure. So I think this is interesting because my answer today is probably different than what I would have given you as a med student or,
really?
Even an early resident. And but now I can tell you as a 5th-year resident, kind of finishing up in a few months.
Yeah.
I think the area of interest, clinical interest, is the most important. And I'll give you my reasoning behind that.
Okay.
Fields change, right? Like the technology you use, the methods you use, whether it's more invasive, less invasive. Ultimately, if you're interested in a subject matter and passionate about it, you're going to find a way to make that work for you.
100%.
If I were to do dermatology, for example, no amount of money in the world would, or even if it was the best job ever, like in terms of hours, would I be happy? Because I'm just not interested in that subject matter as much. And so I think we focus a little too much on some of these other aspects. Again, this is my personal opinion, but I think finding what your passion is most important. Because if you're passionate about something, all these other things can fall into play. And I'll talk about the other things in a bit. So that's my number 1.
Okay, number 1.
Your interest, if you're interested in a subject matter, and you may find that you're interested in multiple subject matters. So it may not help narrow it for some, but that can be good because if you're interested in multiple subject matters, well, then you've got more options. So that can be good. So that's my number 1.
I love that.
For the number 2, I think ultimately, how much patient contact continuity do you prefer? And the reason I'll do that is because there are some specialties where that's just never going to happen. Right? Like if you pick emergency medicine and you want to follow your patients, that's not going to work, right? It's not built in. If you pick radiology, there's no continuity. So the reason I think that's number 2 is because whereas the first one can kind of rule big things, like this is kind of a hard stop, you love radiology, but you want to be with patients. Well, that's not going to work, right? You're not going to be able to follow them, right? So,
right.
I think that's important.
Okay.
The third one's a little hard. I think I'm actually going to put the surgical medical thing pretty far down and I'll explain why in a bit. But I think maybe number 3, I would put work-life balance. I think this is something that burnout is such a big word that's thrown out. And if you love something, You really love it. It feels less like work, but everything ultimately, if you're exchanging your time for money, is work. And so
That's right.
for some people, it might be the most important thing. But I actually think that for most specialties, even the surgical ones, you could make everyone potentially a work-life balance, because there's the option of working part-time. And a lot of these heavy specialties, people don't realize that. Like, there are places that you can work part-time, right? Like, and that's an option. It's a very feasible option, especially in today's world with shortages of certain specialties. Some specialties you'll find, even urology, work 4 or 3 days a week. It's a trade-off, but I think most people are willing to do that trade-off. Now, if you pick cardiothoracic surgery or neurosurgery, that may be less of an option. But there is a lot more variability and option in work-life balance. Now, there are some things that are going to be harder to negotiate, like things like call and such, and that's why I put it as 3, because you may never want to be on call. And so there are options like that. I think it's maybe not the most important, because every specialty you can finagle that a bit, but I think it should be important because people have different life circumstances. You may have kids, you want to spend more time at home, and you may not be too pleasant, like working the wee hours, and you may not want to work part-time, right? So
Yeah. Can I ask you a question on that?
Yeah.
Would you agree to say that, generally surgery, it's a lot more difficult to find work-life balance in surgery? I know surgery is like so vast, right? There's like so many different fields within surgery. But that being said, would you say it's wrong or right to believe that surgery isn't a place for work-life balance?
Well, I think it's all relative, right? Like,
Sure.
If I put dermatology on the one end, 9 to 5, minimal to medical emergencies, all outpatient, then you could have a lifestyle like that in surgery, but you wouldn't be doing surgery. You'd be doing like clinic work as a surgeon. And there are options like that. Usually it's folks towards the end of their career where they don't want to operate anymore, but most people that choose surgery want to operate. So
Right.
I would say the reason it's not really built in like that is because other specialties, anesthesia per se, you can just clock in, clock out in the middle of the case. If someone will come, brief you, and you're gone. There is no like clock out in surgery, right? Like you plan a time for your surgery, but if it's going over, it's going over. If it's going over in anesthesia, well, you're gone as the clock strikes 7. Like someone's going to break you out. And that creates irregularities in your hours, which I think contribute to work-life balance in the long term.
Right.
Because you don't have that shift work built in. So I would say, conversely, not every surgical specialty is surgery 24/7. And so you can have work-life balance built in throughout the week. ENT, urology, you're not operating every day per se.
Right.
You have some clinic. And so I think it just depends on how you structure things, but on the whole, you probably have more work-life balance amongst the non-surgical specialties.
Interesting. Okay, sweet. Let me hear the next one.
So I think that was 3. I think, for number 4, I would say, do you prefer surgical, medical, or mixed specialty? Main reason being, if you never want to use your hands, then, that just does it for you, like you just not something you're into, then, you want to be picking a field where you're going to be thinking a lot and using other skills. Maybe you want to use your hand for the physical exam, but you don't want to be, operating, and maybe you don't want that type of liability either. Every medical doctor has some level of liability, but there's with surgery and procedural specialties, there's the thinking part and then the actual performance part. And those require different skills. They're not skills that are really taught in medical school, but they do require some hand-eye coordination. You don't have to be a professional athlete, but, so that's my number 4. There are 7, right? So number 5, I would say, patient population you'd like to work with. Most specialties, you can even subspecialize to a population. But not all of them. OB-GYN and you want to see males, probably not going to work very well. If you want to just see kids, then you have pediatrics, but you could do a surgical specialty and then do pediatrics. And so I find that most specialties you can, specialize, but maybe not in radiology, right? It just depends, or pathology. And then number 6, I would say, the earning potential. The main reason I say this is, first of all, this can change. I mean, one day this specialty is making a bunch of money, and nobody's a mind reader. Like when I applied to urology, I had no idea that a shortage of urologists was coming, which then results in this massive increase in pay, right? And these things can change, and reimbursement styles can change. But I think if you're really good at what you do, there's a way to make a good income. And certainly medicine, like practicing your profession, is probably not the most efficient way to make lots of money when you exchange the time ratio. But if you're really good at something, there's so many ways you can be creative today to make funds, even outside medicine, using your medical knowledge. Mm-hmm. And then what types of activities you want to engage in? Well, there's research and policy work in every specialty. Even the ones that aren't traditionally research heavy, well, that means there's even more opportunity there. So, so that's my ranking for you.
I love that. I'm surprised that earning potential is towards the bottom, around 6 or 7. You said number 6-ish? Because I feel like I would say a lot of students still maybe put that at least at top 5, top 4. Maybe not consciously, but definitely unconsciously. Because there must be a reason to why primary care, which is generally seen to make the least amount of money relative to the rest of it, other doctors, other fields in medicine, that there's a shortage there, And there might be other reasons, but if an internal med doc was making $500,000, I think it's like that compensation would increase the amount of students going into that field.
Okay, so first of all, I'll dispel some rumors here.
Okay.
There are internal med docs making $500,000.
There's no way.
But
okay, I'm just kidding.
So
okay.
It's actually quite simple though. But you have to. I think this goes back to like the types of people choosing what and why. And I'll give you an example.
Sure.
I have a friend. He lives out in California, and he works for an HMO system there. And when he works more, he makes more, right? Like he's shift work, right? And if you were to equate his hours to that of a surgical specialist, he might even be making more money on the hour, right? And I think this comes down to, well, if you're going into a specialty for work-life balance, well, you're not going to be working the same number of hours, right? Sure, there are reimbursements, procedures do pay more, complexity and so forth. But, I think this is the time when to become a doctor, you have to think in the box because there are no shortcuts. You have to follow the laws, the rules, regulations, and you've been indoctrinated for this for so many years because that's what you need to do to survive.
All right.
But once you leave that training, there are so many ways to be creative. I mean, there are business opportunities and yes, I mean, if you work the standard work hours, some specialties will make significantly less. But that also comes down to like the importance of it. I think there are some people that aren't interested in business or the business aspect of medicine, and they just want to provide good care for their patients and, kind of clock in and clock out. And some people that want to go above that. So I think, again, this is my personal opinion.
Yeah.
That if money is really important to you, well, I would pick probably the specialty with the cushioned hours and then use the extra time that you have to develop your expertise in that. And you see that today a lot with social media, with doctors that realize that there's, even in primary care, there's like a huge unmet need. And there's a different type of medicine that can be practiced today, preventative medicine. There's a new specialty board out there called lifestyle medicine. And anybody from any specialty can go become lifestyle medicine certified. There's a huge need for that because people are living longer, but people want to be healthier too. And that's an uncaptured market. I mean,
wow.
There's a lot of opportunity there.
That's amazing. That's great. And just to add on to that thing, I think what we're talking about is kind of crazy too, because we're talking about like even on the low end, like, for example, like Typically, the pediatric specialties make the least amount of money. We're still talking about $250,000, you know? We're talking about like $250,000. And there's so much data to say that people aren't typically more happier with, you know, I think I saw some stat that said like 70 to 80,000 more dollars. You see less impact on wealth creating happiness for people, which obviously you never know how that data is collected and whatnot. But I've heard that quoted so often.
So it's so that's an interesting point you bring up. So that number is applicable. There actually is, but it's kind of like what you would expect. The number would probably need to be adjusted to like 100,000 today, given inflation.
Sure.
And don't quote me on this, but you can go look back up the numbers. But 70K was basically, there wasn't a significant increase in income above that level for a single individual in which happiness increased. But there actually is a level that is way above that actually happiness does increase, and for very apparent reasons. And I think that might be like 250 to 500. And the reason that happens is when you have enough money to minimize the tasks that you never want to do anyhow. You know, think about how much happier people would be if they had someone, you know, make food for them, perfectly healthy food every single day, and keep their house perfectly clean.
That's true.
Right? Your happiness would increase. It's marginal. Again, there are other things that are way more important. Your family, your social structure.
Certainly.
These are kind of like when you look at people that live really long lives, like their satisfaction rates. Another thing I would say is the people that go into medicine, the ones that pick pediatric subspecialty, had they gone into any other field and put in just the same amount of effort, they'd probably be incredibly wealthy if they, you know, at that level of skill set. Now, there are different skills that doctors possess that others don't, and other skills that others possess that doctors don't, namely talking about like marketing yourself, building a business and so forth. And not everybody wants that. But
right.
I think it goes back to your question, like how important is it? Yeah. Well, if it's really that important to you, you probably pick the wrong field, you know, because dollar for dollar, I mean, I have friends that are incredibly wealthy,
right,
and none of them have pursued medicine. I mean, right, if I put a decade of work into something, it'd probably be pretty good.
Well said. A couple more things. What do you think culture has to play to your decision in choosing a specialty? I've often heard people say that when I rotated through this specialty, I just love the people there. You know, like I love the personalities that like kind of end up entering that field, and they kind of relate to the people there, and they end up just loving the rotation more, and all of a sudden this science is even more interesting to them, perhaps, right? And so the culture of residency seems to play a factor in helping people choose between a specialty or not. What do you think about that?
And that's a hard question, because I fell prey to that, and I'm not saying it was a bad decision. I absolutely am super happy in urology, but I'll give you a story. So when I was a kid, I had this amazing physics teacher. She was just fantastic, and I loved physics because of her. She created this embodiment. Like, physics was so fun. And I went to college, and I was like, oh shit, you know, this is not as fun as it is. You know, and I mean, I was like thinking, man, I'm gonna do some biophysics, maybe, right? And 2 seconds in, I was like, whoa, this is 100% not for me. And so I think you can be fooled sometimes, especially depending at the institution that you're at. Like, I wanted to do orthopedics coming in, and there was nothing wrong with the people in my medical school. I really liked them. But I did urology, and it just clicked a little better for me. I like the people, felt like these were kind of my type of people, and you know, but I think that can potentially discourage diversity in fields, right? Like, you could, you know, like in orthopedics, for example, you've got a lot of guys. I mean, on paper, I mean, it would fit just perfectly. I like lifting, orthopedics.
100%.
They all have like these gym libraries. I mean, you know, there's that culture of that. But what if you're not that, but you really love orthopedics, right? Should that be a barrier? Like, I don't think so. I think you should be able to pick it. Obviously is a decision factor, but you don't know how it's going to be at every institution. And overall, the culture changes when people come and change the culture. It's scary, though, to be the first of your kind, and I imagine this is the case for certain minorities. It's certainly the case for women in many fields. So I would say you got to be brave.
Yes.
And it's a factor, and I think, look, if you really like the people, great, but make sure you like everything else too, and I wouldn't pick it just for the people. One
last question on factors that could impact your decision on choosing a specialty is the job market, especially in relation to quote-unquote mid-level creeps. Mm-hmm. I think that when I first entered medical school, the number one specialty on my mind was ER medicine. And mostly because I scribed in the ER, and I already kind of knew that was cool. And when I mentioned that to everybody, like, I'm talking people who have just been in the, like, they just entered medical school as I did, and they have so much advice on choosing a specialty. But they brought a valid point. It's like so many people keep bringing up the same point, and to say, like, Yusuf, there's so many PAs entering the ER field that will create a job shortage for ER doctors, and it's only going to get worse. And rightfully so, you can see already that, and this is 2021 when I entered medical school. It was just, I think, last year, or maybe 2 years ago, I don't remember, where like the match rate for ER medicine dropped significantly, where there's a lot of open spots. And there might be other reasons to that for sure, and a lot of people have good reasons to that. But people say the same about anesthesia, where there's, anesthetists that are doing a lot of the work, and then one physician is doing medical direction, like managing like 3 to 4 different anesthetists and different ORs, thus creating some job shortage potentially in the future. What do you think about a medical student considering that factor?
It's tough to predict. As an anecdote to that, when I was a medical student, ER was, in 2015 when I started medical school, ER was not very competitive at all. I mean, you could anybody could match EM. And then in 2019, it was crazy. I mean, I had friends didn't match with, back in the day. I mean, STEP is now pass fail, but STEP scores were inflating, and STEPs in the 250s that did not match EM.
Wow.
It was that competitive, and I think there are a few factors at play. It's impossible, unfortunately, to predict as a medical student how trends and things are going to change. For example, in EM, there was a conversion. Some programs went from 3 to 4 years, right? So lengthening the training, right? Which obviously means for some people less appealing now, right? So that changed things. And then the number of for-profit hospitals that have arose and opened EM programs, well, that creates too many spots now. It gets less competitive. They don't fill. And all of a sudden you have hundreds, tons of programs every year going unfilled.
Yeah.
And then over time, medical students see this and it's like, oh, I don't want to do that.
Yeah. The rumors become more believable.
Yeah. Well, I'll give you another example. ENT one year introduced an extra essay, and people didn't want to do it. So they had less people apply. And then they had like crazy high match rate with unfilled spots at top places.
Wow.
And then the next year, it's like, ENTs may be easy to match, so I'll apply that. So there's a kind of like a back and forth. I think some of it, there's some credit to some things like pathology, how's it changing with AI? Like, these are factors that I think are important, but I think it's hard as a medical student and even sometimes for people in the profession to predict how things are going to go.
Yeah.
Legislation can change things, but I think it's a factor, maybe not the most important factor. I mean, if you really love EM, then go into EM and be the best freaking EM doctor.
Yes.
I don't think the specialty as a whole is going away, but, it'll be more challenging potentially. And who knows how things are going to be in 10 years. I mean.
Awesome. All right, sweet. Let's talk about a little bit about the most competitive specialties in the field.
Sure.
We see that of the top 5, you can see on this actually PowerPoint thing I have right here. Mm-hmm. People on YouTube will see it there. You'll see that the top 5 highest specialties with the high Step 2 scores are typically people with the high Step 2 score averages typically represent the most competitive fields. And so you see plastic surgery, dermatology, and ENT averaging a 257. Mm-hmm. And Orthopedic surgery is right below that at 256. Diagnostic radiology took a big jump at 253, along with interventional radiology, which is around 253, and then neurosurgery is 252. Those are the top 5 most competitive step 2 scores in relation to their residency programs. And interestingly, step 1, this is 2022, by the way. I forgot to mention that this is a infographic from Med School Insiders using the 2022 charting outcomes in the match. All right, but anyways, you can see that there's a huge disparity between the top 5 specialties, step 1 scores, and their top 5 lowest specialties step 1 scores. There's like a huge disparity. Like the highest is what? Like 251, and then the lowest the highest is for plastic surgery. Average step 1 score used to be 251, and then the average step 1 score for family medicine was 225. So there's a huge disparity there, but that you don't see that disparity in step 2 scores. Mm-hmm. Did people not try back then or something when it used to be scored?
So first of all, the scoring system's different. It was very well known then, so they're not the same. Like a 220 on step 2 back then was much lower than a 220 on step 1 by percentile rank. Oh. And most medical students don't even know this, but they're not the same. It's much harder to get a higher step 1 score than it is to get a higher step 2. So 251 plastics, a step 1 is actually much higher than a 251 step 2, just by percentile rank.
100%.
So I think, it wasn't that actually the step 1 scores there are actually more impressive than the step 2 scores now. So I would say it probably is probably the opposite of what you anticipate. And
yeah.
You would have to go into the data and look at the percentile rank. But when you get your step report, it will actually show you where that percentile rank is. And you'll see like a 270 step 1 is like 99th percentile. And on step 2, it's probably 88th or 85th percentile or something like that. But you'll see the step 1 and so is step 3. Step 3 is, which you'll take as a resident, has a completely different. So they're not apples to apples. They're different. I'll also point out that urology probably isn't on there because the urology has its own match.
Right.
But its step scores are in line with those top 5.
For sure. I think I tried to find it on the American Urology Association.
They don't publish them every year. But I could tell you from reviewing resident applications, they are in line with those top 5. Sounds good.
All right.
Hopefully that makes sense for the step 1, step 2.
That totally makes sense. So there are so many things to get ahead when trying to enter a competitive specialty. The step scores are self-explanatory. Get the highest step score you can possibly get. Right now, step 1 is pass-fail. Step 2 is probably your best objective measurement. We're going to try to get the highest score we can possibly get. There are so many other things that students want to do in order to buff up their CV, buff up their application for residency. How do you go about that? What do you think, in terms of priority list? There's research as an option, leadership is an option, volunteer experience. There are so many different things you can do. How do you think we should navigate that?
So I don't know if this information is still out there. It should be, but each specialty is actually a little different with what they preference.
Oh, really?
Mm-hmm. There's a book out there. I'll have to let you know what it is.
Yeah, please.
But I had a red cover, and they had interviewed, it was I don't know, what folks want to match. And they interviewed program directors, 30 to 50 or some from each specialty, from the top programs. And they asked them to rank, what is their preference? And it's a few years old, but that's where they ranked things. For example, letters of recommendation in urology were really high. It's a small, tight-knit field. People know each other. So that actually mattered a lot more than other things. For some places, it was prestige of the medical school and so forth. And so I think it's important to know what field you're going into, right? Maybe having a super crazy high step score doesn't even really help that much if you're going into PM&R, right? Because they're not looking for that necessarily. Surely it helps, but maybe not as much as getting to know the people at your institution, for example. So I think, first of all, know what field you're going into.
Okay.
Because then you can tailor it to what is going to be really important.
Okay.
This is beyond like get the best Step 2 score, right? That's going to be kind of fixed.
Right.
Study hard, etc. What I think most medical students fail to do is to create a personal connection within their own department. I think it's kind of like the hidden curriculum. People don't tell you about that. But if you're a med student, the program director knows you, the chair knows you, some faculty know you, and they're like, hey, man, Yusuf, he's just on it, man. He's like, super helpful. Get to know the residents, politely in a good way. I mean, it could backfire on you, right? You could be annoying or,
yeah.
But if you get to know them, form that personal connection. I mean, that's you're gonna have the best chance at your home program where they know you the best.
Right.
And at the very least, if they know you and you're serious about it, they can make some phone calls for you, and that can go a long way.
That is amazing advice, man. Okay, sweet. How important is honoring a rotation? Or in other words, are some institutions, especially at University of Wisconsin, they do like an outstanding evaluation, for example?
Yeah, that's a tough one because like at my med school, there were no grades the first 2 years.
Right. Same.
And then the third year and fourth year was honors or pass-fail. And now it's just pass-fail. So they did away with honors completely. And actually, a lot of the top medical schools don't have any grades. It's all pass-fail. There's no honors. So I think just try your best, but don't worry about it. I mean, there's some programs where they really harp on whether you have honors or not. But like I said, a lot of the top programs don't even have honors as an option because they realize the subjectivity of rotations, where you rotate, who you have, etc. I think if you show up, you do the work, you do the best you can, people are going to notice that. And even if you don't have honors, I mean, hopefully that shows in the letters of rec that, you did the best you could. And I think that goes a long way. But sometimes whether you honor or not, it's not going to be up to you,
Right, yeah.
Is it the shelf that counts more? Like, how you were on rotations?
Right.
Who you had? I mean, don't stress about things that you can't control.
I get that. Thank you, man. Thank you, Dr. Jeremy. What is your message, your last message to students trying to be amongst the best and land their dream residency?
I think just keep an open mind and try to make connections with people. I think ultimately, even if it's not the field you go into, medicine's a small world. And being able to draw on these people later on in life, I mean, anybody can help you.
All right. Sweet. Thank you so much.
All right, yeah, thanks for having me.
Appreciate you.
Yeah.